Every 3 minutes, someone is diagnosed with a form of blood cancer in the United States. A lot of people just don't realize just how many different types fall under the blood cancer umbrella. So why is it important to be specific? With that, blood cancer expert Dr. Stephanie Gregory. Doctor, good morning. How are you today?
Good morning.
How common are blood cancers? I guess what makes them unique as well?
Well, they're unique because they're actually called liquid tumors. They circulate throughout the entire body because they are tumors of the bloodstream, the bone marrow where blood is made, and also the lymph nodes which follow the blood vessels and are the immune system.
When it comes to the specific type, why is that so important to know?
Well, you know, there are so many different kinds of blood cancers, especially the most common blood cancers, which are the lymphomas. We talk about blood cancers as leukemias, lymphomas, multiple myeloma, but the most commons are really the lymphomas. And the lymphomas, they're called non-Hodgkin lymphoma. There are 60 different types.
Yeah, and there's a specific type we're talking about today as well, and treatment options for that relapse refractory follicular lymphoma.
Yeah, so remember I said there are 60 different types. That's why you need to say to your doctor, what type of lymphoma do I have? The follicular lymphomas are the second most common, follicular lymphomas are the second most common lymphoma, and it accounts for about 1 out of every 5 patients with lymphomas. They are not curable in general, but patients can live a long time with them. And so they're treated over and over again. So when you talk about relapse refractory follicular lymphoma, you're asking me about that patient who has lived for several years, they've had several treatments, and maybe those treatments aren't working as well anymore. So there is actually a new option available now. It's called Gazyva. It's produced by a company called Genentech, from which I'm representing today, and it's added to a chemotherapy drug called bendamustine, and it actually works in patients who have already had several treatments and they're no longer responding to some of those treatments. Now, obviously, all therapies have side effects, so you need to talk to your doctor about those side effects. You also need to know if you're a candidate for these treatments that you haven't had before. So it is another option available for patients who have been treated over and over again for relapsed refractory follicular lymphoma.
Yeah, obviously our doctors out there, but with resources, what's available for people with blood cancers?
A lot of very good resources. The Lymphoma Research Foundation is one of the best websites. It's lymphoma.org, as is the Leukemia Lymphoma Society website, which is lls.org.
Gotcha. Doctor, thanks for your time today. We appreciate it. We know there's a lot of people out there.
Thank you.
Families affected with these type of disorders. Thanks for your time.
Thanks, Mike.
All right, Mary, over to you.